Our first topic introduces you to functional screening. What is functional screening? Put simply, it is a quality of movement assessment which also encompasses the analysis of static posture. This is the starting point for anyone who wants to exercise. This section will cover the basic postural and movement screens that will inform your own training program. Movement ability has often been overlooked as a component of fitness, and functional movement screens can reveal poor movement patterns, imbalances, or weak muscles in the general population. Therefore, screening has the potential to reduce injury risk and better prepare the body for subsequent training and exercise. This is important to ensure overall quality of movement, maximizing the benefits from your training program, and reaching your goals without risk of injury. Many screens exist to assess quality of movement. All seek to reveal either compensatory patterns in movements or expose imbalances in stability and mobility that may exist throughout a given movement. Throughout this section of the course, we will describe several forms of screening that will assist you in identifying imbalances within your own movement pattern or indeed a friend or colleague. We will describe 3 basic screening tools that can be implemented with the use of minimal equipment. Firstly, we will describe standing posture assessment before progressing to a simple self-posture assessment. And finally, we describe the most common movement assessment of all, the overhead squat. Static posture. The first go-to in terms of what to assess when describing anyone involved in movement and exercise is the static standing posture assessment. We start by considering what normal means in relation to posture. The concept of normal posture is an interesting one, as normal may not imply what is common or standard. Given the prevalence of posture imbalance, we could argue that what constitutes normal is now a problematic condition. Thus, we suggest that we speak in terms of aligned posture when referencing so-called good posture. Aligned upright posture is important, as it allows optimum efficiency of joints during static positions and dynamic movements. It also facilitates normal and complete range of motion about the body's joints. What are we looking for in terms of assessing static posture? Firstly, we use a plumb line or posture chart to set up prior to screening. This will allow you to easily observe the alignment of standing posture from the side. A plumb line is a piece of string with a weight attached to one end and is used to test if something is vertical. In functional screening, this vertical line can be used to assess deviations from what is considered optimal posture. Setup. What should we see? Key faults for the upper body. Key faults for the lower body. Setup. The plumb line should be slightly in front of the ankle bone to begin. Once set up, take a deep breath, exhale, and stand in your natural posture. What should we see? For optimal alignment, the plumb line should pass through the knee, hip, shoulder, and earlobe. Key faults for the upper body. In this example, we note rounded shoulders and a forward head, where the earlobe is in front of the plumb line. Key faults for the lower body. In this example, we note an excessive arch or curve in the lower back. Wall posture test. It may be difficult to assess yourself in terms of static posture. There is a self-assessment that can be administered that will make it easier to identify the 2 key faults we are focusing on. Setup. Key faults for the lower body. Key faults for the upper body. Setup. Stand slightly away from the wall, take a deep breath, exhale, and stand in a natural posture. Place your hand in your lower back and slowly step backwards until your heels, hips, and the upper back touches the wall. Key faults for the lower body. Placing your hand in your lower back will identify if you have an excessive arch. Your hand should be able to touch both the wall and your lower back for optimal curvature. If there is a big gap between your hand and the wall, then there is an excessive arch in the lower back. Key faults for the upper body. If your head does not touch the wall naturally and requires some adjustment, you likely have a protruding head. The severity will depend on the amount of adjustment required to touch the head to the wall. Tight and weak muscles. Forward head. Excessive arch in the lower back. Please view the accompanying table for a breakdown of the weak and tight muscles associated with both upper and lower crossed syndromes. Forward head. A roundedness of the shoulders is demonstrated here and may also be termed a C posture. Overdevelopment of the chest, frontal shoulder, and upper trapezius muscles. This is combined with weakened and overstretched in the mid to upper back and neck muscles. This condition is also referred to as upper crossed syndrome. Excessive arch in the lower back. An excessive arch seen in the lower back can be described by tight lower back muscles crossed with tight hip flexor muscles. In opposition, yet in a weakened relationship to these overactive muscles, we find the gluteal and abdominal cross pattern. In addition, with this condition, the quadricep muscle group tends to be tight. This condition is also referred to as lower crossed syndrome. Onset of poor posture. Throughout the posture assessment, we identified two key faults that are quite common amongst the general population. Faults are generally as a result of a muscle imbalance, where one muscle group may be overactive or tight, and the opposing muscle group may be long and weak. This will cause a shift from optimal alignment as the body adjusts and compensates due to a muscular imbalance. A muscular imbalance may be caused for a variety of reasons. Your body may be compensating to protect an injured area or excessive exercise of one muscle group while neglecting the opposing muscle group. This is quite common in such conditioning routines that utilize bench pressing while neglecting exercises for the upper back and thoracic region. Also, common daily routines such as sitting for long periods of time at a desk or driving can be problematic with the onset of poor posture. Overhead squat introduction. We have described posture and the two key faults that may be commonly observed. Next, we want to assess movement quality in the form of the overhead squat. The findings from the postural assessment will also complement the movement pattern that will be observed in the overhead squat. Furthermore, it will contribute to a greater understanding of the interaction between posture and function. The squat is a common movement pattern used in general fitness, sport, and even daily routines, such as sitting or standing from a chair. This particular variation of the squat challenges stability of the torso, in addition to assessing mobility of the ankles, knees, hips, and shoulders. Clothing. Before administering the overhead squat, ensure that you are dressed appropriately. For males, this can be shorts and a singlet or t-shirt. For females, shorts or leggings and a t-shirt are suitable. We recommend that you remove your footwear prior to screening. This allows for greater standardization between tests and will illustrate key compensations that footwear may conceal. Overhead squat. Setup. Administration. Observations. Setup. Stand comfortably, shoulder width apart, with feet pointed directly forward. Place dowel on the head with elbows flexed to 90 degrees. Extend arms directly overhead. Now you are ready to begin the screen. Administration. Squat down as low as possible whilst keeping the dowel pressed overhead throughout. Observations. Thighs move parallel or just below. Torso is parallel to the tibia. Knees aligned over the feet. And the feet are facing forward. Overhead squat, key faults. Here we present some of the common faults that may be observed during the overhead squat. Click on each thumbnail to watch the video clip of each fault. Squat without arms. If there are any compensations present during the overhead squat, the next step is to progress to a follow-up test with a view to establishing the cause of the compensation. The squat without arms allows us to see the influence the upper body has on the overall compensations throughout the squat pattern. This modification will also help us to determine whether the restriction is located in the upper or lower halves of the body. Should you gain a greater depth without the arms overhead, then there is likely a stability or limitation present in the upper body. With the arms across the chest, complete the standard squat, noting if there is any change in squat depth. Results. If you achieve a deeper squat without arms, then the restriction is likely in the upper quarter. This may be as a result of one of, or any combination of, a forward head or rounded shoulder posture, limited latissimus dorsi flexibility, limited thoracic spine extension, poor shoulder mobility, or underdeveloped torso stability. If there is no change in squat depth, or other compensations persist, the restriction is likely within the lower body, namely the ankle and hips. Conclusion. We have concluded the functional screening section of this course. We described some useful screens to assess your static posture and quality of movement. These included posture assessment, self-posture assessment, the overhead squat, and the squat without arms. These screens will offer insights into your posture and movement competency. Both types of screens interact together, as faults noted during the posture screen may also be noted in the overhead squat. You should now understand the basics of functional screening and be competent in assessing and administering a basic screen. Remember, screening is an appropriate starting point which will direct your exercise program and reduce your risk of injury.